Bienvenido a la guía de cómo registrarse en el sitio web de The Global Health Network. En este sitio tendrás acceso a cursos, materiales y demás herramientas totalmente gratuitas. Para registrarte, debes ingresar a la página tghn.org o The Global Health Network. Luego, debes hacer clic en el botón de Register o registro, ubicado en la parte superior de la pantalla. Después deberás completar los siguientes datos: nombre, categoría de trabajo, correo, confirmar correo, contraseña y confirmar contraseña. Una vez completados tus datos, debes hacer clic en "Estoy interesado en seguir los tópicos". Al hacerlo se desplegará una lista de temas. Haz clic en todos los que sean de tu interés. Para enfermería recomendamos que mínimamente estés registrado en los siguientes: 1000 Challenge, Global Research Nurses y The Global Health Network Latinoamérica y el Caribe. Luego de seleccionar los temas de tu interés, debes hacer clic en el botón de Register o registro. Tras hacer clic en el botón de registro, se te enviará un correo de confirmación y activación de la cuenta. Deberás hacer clic en el enlace que se te envía. Y es así que habrás completado tu registro en el sitio web de The Global Health Network y podrás ingresar con tu usuario y tu contraseña. Y de esta manera podrás disfrutar de todas las herramientas que te ofrece este sitio. De igual manera, te invitamos a unirte a la comunidad de práctica de The Global Health Network Latinoamérica y el Caribe.
Hola, ¿cómo están todos? Buenas noches. Estamos muy contentos de compartir este espacio una vez más con ustedes, este seminario virtual de la Fundación Éticos, gracias al auspicio de la Red de Salud Global y TGHN en Latinoamérica y el Wellcome Trust. Hoy tenemos a una fabulosa presentadora que va a discutir, conversar el tema de navegando por los desafíos éticos y la atención en salud. Gracias a Éticos Academy hemos podido organizar este evento. Esta sesión va a estar grabada y se subirá a nuestro canal de YouTube de la Fundación Éticos. Para mantener el orden en el número de participantes, las cámaras y micrófonos han sido apagados y estarán así durante el evento. Pueden utilizar el chat para presentarse e informar cualquier problema técnico que puedan tener. Cuando se presenten, pueden utilizar su nombre, su apellido, mencionar de qué institución vienen, qué región de República Dominicana o si están residiendo en otro país. Además, pueden utilizar el chat para hacer preguntas y comentarios que luego vamos a intentar responder durante el webinario. Estamos muy contentos de tenerles acá presentes. La agenda del evento es tener este espacio de bienvenida con todos ustedes. Vamos a exponer cuáles son los objetivos. Presentaremos también la biografía de nuestra presentadora del día, Emily Grime, y pasaremos luego a escuchar lo que nuestra presentadora tiene que decirnos en cuanto a navegar por los desafíos éticos en salud. Vamos a finalizar con una ronda de preguntas y respuestas, que nuevamente siéntanse en confianza de utilizar el chat en todo momento. Muy bien, pasamos a definir cuáles son los objetivos de la sección. Vamos a conversar sobre la ética organizacional en la atención en salud. Sobre todo, ¿cuál es el rol que tiene la ética organizacional en el día de hoy, en la actualidad y su importancia? Vamos a destacar dilemas éticos reales y sus soluciones. Se va a proporcionar estrategias, prácticas para implementar políticas y prácticas éticas. El cuarto objetivo será fortalecer los marcos de toma de decisiones éticas en las organizaciones y, finalmente, mejorar el cumplimiento de las normas éticas y regulatorias. Ese es el contenido que vamos a cubrir en el día de hoy. Estamos contentos de presentar a la doctora Emily Grime, doctora en bioética y en políticas de salud por Albany Medical College y con certificación especializada en toma de decisiones éticas y gestión de proyectos organizacionales. Emily es una líder mundial en la industria farmacéutica. Tiene más de 15 años trabajando estos temas a nivel global, diseñando estrategias para implementar procesos, desarrollar equipos y alinear organizaciones incluidas en temas de project management a nivel global y también en marcos Kami-Shabai para mejora ética continua. Así que tenemos frente a nosotros una gran expositora que además codirige el grupo de afinidad en ética organizacional de la Asociación Americana de Bioética y Humanidades Médicas. Allí ella asesora a grupos en sistemas de salud y sobre ética laboral. Además colabora con Persevere, que es una organización sin fines de lucro que apoya a estudiantes encarcelados en su proceso de reintegración. Finalmente, ¿qué podemos decir de Emily? Es una apasionada del liderazgo ético y está comprometida en fortalecer programas educativos, programas de implementación de normas, programas éticos, y esperamos prontamente contar con Emily en una visita en República Dominicana para conversarnos sobre estos temas en persona. Hoy vamos a tener la posibilidad de escucharla y ir aprendiendo sobre estos temas éticos y estos retos en la salud a nivel público y a nivel privado. Así que Emily va a tener una presentación en inglés. Luego, esta grabación va a estar disponible en YouTube, en nuestro canal, y las traducciones van a aparecer eventualmente ya una vez esté grabado. Así que muchas gracias por su atención y pasamos a Emily. Emily, welcome. We are very happy to have you today with us and talking about a subject that you really love, that you really embrace ethics in your professional practice. So we are happy here in Dominican Republic with our students, professors, and general public being able to listen to you today. So thank you.
Thank you. Thank you so much for having me. It's been an honor to be chosen to speak tonight. So thank you all for joining. Give me 1 second while I set up my slides. Okay. I think they're coming. Perfect. So thank you so much again. Once again, my name is Dr. Emily Grime. I'm here tonight to talk to you about navigating ethical challenges and strengthening organizational ethics in healthcare. This is a very important topic that's very near and dear to my heart. I think that it really takes a team of individuals to work on healthcare challenges. So I want to talk about that the healthcare industry faces different complex and ethical challenges. And what this webinar aims to do is to educate professionals on the role of ethics in fostering transparency, accountability, and trust. Julio went over the objectives, but they include defining what organizational ethics are, how we are working towards resolving dilemmas, and implementing ethical policies. So the first thing when we think of organizational ethics is ethical leadership and corporate responsibility. And how I have this presentation set up is to talk about different case scenarios that you might encounter as a healthcare professional and what the discussion is, and then also what the options could be if this came up in your workplace. So the first one, when we think of larger scale and ethical leadership and corporate responsibility, a case study could be that that a hospital CEO must decide whether to disclose a data breach affecting patient records or not. So the hospital CEO knows that a data breach has happened. It does affect patient records. So when we think about this, basically the discussion goes to the role of ethical leadership in maintaining the public trust. So when we think of I'm the CEO, what should I do? Different reasons to disclose that you had this issue is that number one, it maintains that public trust. You have transparency. It reinforces trust within the community. It also shows that the hospital prioritizes patient rights and ethical responsibility. A second reason is legal and regulatory compliance. There's different healthcare laws that require if you breach, you need to send a notification. It could prevent legal penalties or any sort of damage to your reputation. There's also proactive reputation management. So you as a CEO are controlling the narrative or the story that shows, and you are allowed to show accountability rather than reacting to leak or misinterpreted information. Another reason, patient protection. So early disclosure allows patients to take the precautions, meaning to monitor their records, secure their data, and present further harm. And overall, it strengthens institutional integrity. It demonstrates ethical leadership and reinforces internal morale, encouraging a culture of responsibility among the staff. So if you decided not to disclose this breach, things that could happen would be a potential public panic. So announcing the breach could cause fear and anxiety in patients. It could damage confidence in the hospital's security measures. There could be financial and legal repercussions. The hospital may face lawsuits, fine, a decline in patient numbers, and impact their long-term financial stability. It could also damage the reputation. So even if you want to be transparent, a data breach can really tarnish a hospital's image. It loses trust. It uses a competitive standing in the community. It also impacts operational disruption. So not only are you handling patient concerns, you're handling media inquiries, you're improving security measures, and you're diverting resources that could be used for healthcare and now to help and support this data breach. And last is the risk of miscommunication. So if the disclosure is not handled carefully, the message could be misinterpreted, which then exacerbates fears and basically leads to misinformation. So what is the ethical intervention that we could do? So while disclosing that we had a data breach carries risks, it's much higher to maintain that trust and ethical integrity because it's crucial for the long-term community confidence. So coming up with a well-structured communication plan that reassures patients, outlines what actions you're going to take to fix it, and providing clear next steps that can really help to mitigate any negative impacts while reinforcing that accountability that you are taking. So our next case study is about patient rights and informed consent. So for the case study, if a patient refuses a life-saving procedure due to religious beliefs, okay? So the discussion is, how do we balance that patient autonomy, meaning the choices that the patient is allowed to make, with our medical responsibility, okay? So we want to respect the patient's decision. So by honoring patient autonomy, one of the fundamental ethical principles of autonomy ensures that patients have the right to make decisions about their own bodies, even if those choices result in harm or death. So we want to respect also their religious and cultural beliefs, acknowledging their religious values that fosters inclusivity, trust, and is really a patient-centered approach in healthcare. We also want to build trust between the patients and the providers. So demonstrating the respect for a patient's value enhances the relationship between the healthcare team and also the patient's family, reinforcing that compassionate care. We want to reduce legal and ethical risks as well. So forcing treatment against the patient's wishes could lead to lawsuits, ethical violations, particularly if the patient is sound of mind and has provided informed refusal. So not really a case of if the patient isn't of sound of mind, but if they are. We also want to ensure that things align with informed consent standards. So making sure that the ethical and legal guidelines require that the patients receive all the necessary information to make an informed decision, even if it means declining the treatment. Okay, so now let's switch to the other side. So if we want to respect the medical decision, so from the provider's viewpoint, they might be thinking they have a medical responsibility to preserve life. So physicians take an oath to save lives, and allowing a preventable death can be distressing and challenging for the healthcare team. It provides moral distress for the providers. So healthcare professionals may struggle emotionally and ethically when a life could be saved, but it's not due to a patient's refusal. You could have an impact on the family and the loved ones because family members may disagree with the decision, and this leads to emotional distress and potential conflicts in the healthcare setting. You have a risk of legal challenges. So in some cases, particularly with vulnerable populations, so minors, questionable decision making, refusing treatment may lead to those legal interventions, questioning, do they really have the right to make the decision for themselves? And lastly, we like to think of public health considerations. So if the refusal of care involves an infectious disease or a broader health concern, it could impact more than just the individual patient. So these are kind of the viewpoints that the provider is having for both sides. So we want to make sure that we're balancing the patient autonomy and also the medical responsibility. And how we do that is by firstly open communication. So we want to engage in a compassionate dialogue with the patient and the family so we can explore alternatives and ensure that they fully understand the risks that they're taking. You may want to bring on what's called an ethics consultation, so seeking input from an ethics committee. This can help provide guidance on a complex case. It can also help balance religious freedom and medical duty. You can also talk to the patient about exploring alternative treatments. So identifying treatments that maybe align better with the patient's beliefs may offer a compromise that supports both autonomy and the medical care. And lastly, we always need to think of the legal and the policy considerations. So if the patient is legally competent, their right to refuse treatment must be upheld. Cases involving minors, incapacitated individuals may require intervention. So we need to look at that as a whole. So when we think of what's the ethical intervention, so when a healthcare provider has a duty to save lives, respecting patient autonomy, that's a core ethical principle. So the best approach is to ensure that the patient is fully informed, to offer support, and explore all options that align with both their beliefs and the medical needs. So next, let's talk about workplace ethics. So addressing bias and discrimination. So our case study for this one is a whistleblower exposes racial disparities in patient care. So our discussion is strategies for fostering diversity, equity, and inclusion in our medical field. So when we have someone exposing racial disparities, what's happening is it's promoting health equity. So when we're bringing disparities to light, this can really drive systematic change. It can ensure that all patients receive fair and equal care. It encourages accountability. So exposing discrimination holds healthcare institutions and provides providers accountable for addressing these biases in treatment. It improves the patient trust. So transparency and addressing disparities can help rebuild the trust in marginalized communities and encourage them to seek the necessary care that they need. It also drives policy and training improvements. Awareness can lead to new policies, diversity training, and better data collection to track and reduce racial disparities. It also supports ethical and legal standards. So when we're addressing racial disparities, we make sure that they align with the ethical principles of justice and non-maleficence while also complying with anti-discrimination laws. So if we were to not expose the racial disparities, we have a risk of retaliation against the whistleblower. So the whistleblower may face professional repercussions, including job loss, harassment, or exclusion. There may be damage also to the institution's reputation. So public exposure of disparities can cause harm in the healthcare organization's credibility, excuse me, potentially reducing patient trust and also funding. You may have a resistance to change. So some individuals or leadership may deny the issue, and this creates internal conflict, and that really makes reform efforts or things to change very challenging. So when we're looking at legal and financial risks, it may lead to more lawsuits, regulatory penalties, loss of grants or funding, and this could impact the hospital operations. And then also in a short-term operational disruption, it requires resources. It requires policy changes. It may require staff retraining, and that can temporarily strain the healthcare services that could be used for patients. So we want to find that balanced approach. So if a whistleblower exposes a racial disparity, leaders must respond thoughtfully and also proactively. So first and foremost, acknowledge the issue. So publicly recognize the concerns, commit to investigating them with transparency. You can also conduct an independent review. So you can engage external auditors or diversity experts to assess disparities and recommend corrective actions. You can ensure the whistleblower protections. You can follow ethical and legal protocols to protect the whistleblower from retaliation. You can also engage affected communities. So working with patient advocacy groups to understand community concerns and co-develop solutions. So work together effectively. By doing this, you're then going to create a foster and a culture of inclusion. So this encourages open discussions on racial disparities, makes diversity, equity, inclusion an ongoing priority in organizations. So different strategies for fostering the transparency when you're doing it. Some people like to implement bias training. So educating staff on an unconscious bias, a cultural competency, or equitable treatment practices. Some people like diversified leadership. So ensuring the hospital leadership and decision makers reflect the diversity of the community that they serve. You may want to standardize care protocols. So using data-driven guidelines to ensure that all patients receive the same quality of care regardless of race. You can strengthen the data transparency. So when you regularly report and track racial disparities, you're able to identify gaps and then measure progress to success. This also empowers patients. So it provides language access services, patient advocacy programs, and creates a culturally sensitive care for the patient. So also when you are establishing reporting mechanisms, create a safe and anonymous way for employees to report concerns about bias and discrimination. So the ethical intervention with this is while exposing racial disparities can be challenging, it's a necessary step toward achieving health equity and ethical integrity. By addressing the issue pretty much head on, committing to systematic improvements, healthcare institutions can build trust, they can enhance patient outcomes, and create a more just healthcare system. Next, let's talk about financial ethics in healthcare. So our case study is a pharmaceutical company basically pressures a hospital to promote a high-cost drug over a generic alternative. So our discussion will be ensuring that there's financial decision-making that aligns with ethical standards. So the first thought is to promote the drug. So why would the company want to do that? Well, they want potentially higher quality or a newer treatment. So this may offer superior efficacy, it may have fewer side effects, or it has an advanced formulation compared to the genetic drug. There could be financial incentives for the hospital. So they could get rebates, they could get funding from the pharmaceutical company, and that can help them to support other healthcare initiatives. There may be stronger industry partnerships. So this partnership with the pharmaceutical company may lead to future research collaborations, maybe more funding, maybe more access to cutting edge treatments that they could have. And then you have physician confidence in a branded medication. So some healthcare providers trust branded medications due to the extensive clinical trials and the marketing support that they have, as opposed to generic. So if we weren't going to promote the drug, the reasons behind not doing it would be that we have some ethical concerns with patient trust. So promoting an expensive drug over an equally effective generic can compromise patient trust and violate ethical standards in that financial decision making. So it definitely puts a higher financial burden on patients and insurance providers. So patients may struggle to afford the medication, and that leads to non-adherence, worse health outcomes. They're not taking their medication. Okay. They may have potential legal and regulatory risk. So favoring a high-cost drug due to pharmaceutical pressure, that can lead to conflicts of interest, legal scrutiny, or regulatory violations. Ignoring any sort of cost-effective alternatives, this makes the high-cost alternative unnecessary. It creates it just to be an unnecessary financial strain that the patient doesn't need to deal with, in a sense. And you also might have that negative public perception. So if this was exposed that you were promoting one just because you got kickbacks or rebates, the hospital's reputation could suffer, and that leads to public backlash, loss of that credibility in the community. So how do we ensure that financial decisions align with our ethical standards? So you want to have first transparency in decision making. So hospitals should disclose any financial relationships with pharmaceutical companies to ensure accountability. You want to have what's considered evidence-based prescribing. So medicine should be recommended based on clinical effectiveness rather than financial incentives. You want to make sure that there's a cost-benefit analysis for the patients. So consider the affordability and accessibility when you're selecting treatment options. When we think of the ethics and the oversight, we want to make sure that there's policies and ethical review boards to prevent any undue influence from pharmaceutical companies. And lastly, there's always education for healthcare providers. So be sure to train physicians and staff on ethically prescribing practices and any potential conflicts of interest that they may come from. So the ethical interventions is, while high-cost medications, they may have benefits, financial decision-making in healthcare must prioritize patient well-being, affordability, and ethical integrity. Hospitals should resist undue pharmaceutical influence and make prescribing decisions based on clinical evidence and patient needs, not financial incentives. So next, let's talk about a hot topic, which is the ethics of AI and emerging technologies in healthcare. So a case study could be that a hospital adopts an AI-driven diagnostic tool that shows bias against certain demographics. A discussion that we're going to have is implementing ethical AI policies to ensure fairness in patient care. So when we think of implementing AI in diagnostics, some reasons that we may do that are that it improves efficiency and speed. So AI can analyze a whole lot of data quickly. It can lead to faster diagnosis and treatment plans. It may have enhanced accuracy, so it can detect patterns that human clinicians might overlook. This could potentially improve diagnostic accuracy in certain conditions. Some would argue that it reduces physician workload. The automation of it allows healthcare professionals to focus on patient care rather than the data analysis that an AI could do. Cost savings is always a factor. So AI-driven diagnostics, it can reduce healthcare costs by minimizing any sort of unnecessary tests and optimizing the treatment plan for the patient. It also has a potential for continuous improvement. So machine learning models, which is how AI and artificial intelligence is built, they can evolve and improve over time as more data is analyzed. So there's always continuous improvement that can make the AI better and faster and more correct. So why would we not want to implement AI in diagnostics? Well, for the first one, health disparities and inequitable care. So, if the AI model is biased, certain demographic groups may receive inaccurate or delayed diagnosis or even worsen existing health inequities. There could be an erosion of patient trust. So patients who feel misdiagnosed or underserved because they were, seeking care with AI and then it was biased, they could lose trust in the hospital and they could avoid seeking care in the future. There could be legal and ethical risks. So, biased decisions based on AI data can result in lawsuits, regulatory scrutiny, and violations of ethical healthcare standards. The lack of transparency, which is what is called in AI, meaning the black box problem. So they operate as black boxes, meaning that it's difficult to understand how decisions are made and how to identify bias because it kind of lives in this black box. And then we worry about an over reliance on AI. So clinicians may become overly dependent on the recommendations of AI. They could overlook critical patient specific factors that require human judgment. So, how do we implement ethical AI policies and ensure fairness in patient care? So, we want to make sure that we have regularly testing of the AI models to identify and then correct bias, so affecting different demographic groups. So, think of this as creating an audit based on the bias and then continually improving it. We want to have a diverse and representative training data. So make sure that the AI is trained on data sets that accurately reflect all the patient populations and that minimizes the bias. We definitely need to have human oversight and clinical validation. So the AI should complement and not replace human judgment. The required final review should be by a healthcare professional and not an AI. We need to have transparent AI decision making. So use explainable AI models that allow clinicians to understand how did the system arrive at its conclusion. We need to have an ethical review or regulatory compliance. So basically a committee to oversee implementation, ensure fairness, and comply with regulatory standards. We also want to make sure that we have patient and provider education. So you're training the healthcare staff on how AI has limitations and also informing patients how AI is used in their care. So what is the ethical intervention here? So while AI has the potential to revolutionize healthcare by improving efficiency and accuracy, the bias that could occur in diagnostic tools can lead to harmful disparities. So hospitals must adopt ethical AI policies that prioritize fairness, transparency, and human oversight to ensure equitable patient care for everyone. So those are the different scenarios that I wanted to talk about now. But my question really is, what do we do now? So we want to establish organizational ethics. So basically, including organizational ethics in a healthcare practice is essential, and it ensures fair, transparent, and patient-centered care. So ethical principles can help guide decision making. This can help healthcare providers navigate these complex moral dilemmas, such as patient autonomy, resource allocation, and conflicts of interest. A strong ethical framework promotes trust among the patients, the staff, and the community. This reinforces accountability and compliance with legal and regulatory standards. So when we embed the ethics that we're talking about into the daily operations, healthcare organizations can prevent discrimination, they can uphold professional integrity, they can foster a culture of respect and equity, and this ultimately improves patient outcomes as well as the organization reputation. So if I was going to tell you anything and you wanted to come up with an action plan for implementing organizational ethics, this is basically the chart that I would tell you to do. The first thing would be develop an ethics committee. Work within your organization to say, do we have an ethics committee? How can we start to do this? The second thing would be implement an ethics training program. So take the committee that you have and think about what training programs that we can work on, that we have, that we don't have, that we can build. Then when you do that, enhance the reporting mechanisms. So when we're having the training programs, we want to collect data to say, 20% of our staff had no idea what ethics were. And now that we have done training, we can confidently say 50% of our staff is aware of what good ethical policies are. So that's basically enhancing those reporting mechanisms. Another way that I've seen is to integrate ethics into performance evaluations. So as an employee, are you making ethical decisions? Are you using the AI that we've implemented effectively and also ethically? Did you have an HR issue and, we used and supported what we learned in the training program to integrate ethics, and therefore we got a good performance evaluation. And lastly, you want to be sure that you're always regularly reviewing and updating the ethical policies. Just like AI, which is the hot topic, it's always changing. Ethics is changing. Communities are changing. What's important and what we have to deal with on a daily basis is constantly changing. So be sure that you're regularly reviewing and updating those ethical policies. All right. What are the benefits? Why would I tell you to incorporate ethics into a healthcare organization? First and foremost, you're going to have stronger patient trust and satisfaction. So this fosters transparency and ensures that patients feel respected and valued, and it enhances their trust in the organization. The second big thing is it improves their quality of care. It prioritizes that patient well-being that leads to a fair, unbiased, and high-quality treatment decisions. Next, you have enhanced staff morale and retention. So when you work in a culture of integrity and fairness, this improves job satisfaction, it reduces burnout and turnover among healthcare employees. Ethical practices, they also help adhere to any sort of healthcare laws, so that reduces the risk of lawsuits, penalties, and any reputation damage. When you don't have these issues, then your organization has a better reputation. So you have a better public image. This attracts more patients, more partners, and more funding opportunities. And more equitable and inclusive healthcare ensures that all patients receive this fair treatment regardless of their background, and that fosters the diversity, equity, and inclusion that you want at your hospital. So when we think about what we learned, I hope that the webinar equips the healthcare professionals on this call with the knowledge and tools to uphold ethics. I want to deliver a robust ethical framework that improves the trust, the morale, and the organizational success. And I want to tell you that you can be the change in your organization. So when you're thinking through this, and now that you've sat in this presentation, you're thinking, okay, I don't know if my organization has an ethics committee. When you're starting off, it can be a little overwhelming. So some key questions you want to ask your organizations about starting it up are leadership and commitment. Is the leadership committed to fostering an ethical culture? And then who will be responsible for overseeing and enforcing these ethical standards? Next, you want to look at policies and guidelines. Do we have that formal code of ethics? Does it align with our mission and our values of the organization? How will ethical policies be communicated to staff and to the stakeholders? Training and education. What types of ethics training will be provided for employees at all levels? And then how often will training be updated to reflect these new challenges that we're having? You want to think through reporting. The mechanisms will be in place for staff to report ethical concerns without fear of retaliation. How are we going to do that? And how will ethical breaches be investigated and addressed? And then lastly, patient-centered ethics. How will ethical decision-making ensure patient autonomy, informed consent, and equitable care? What processes will be in place to handle these complex ethical dilemmas involving patient care? So when you're going to your organization to implement these things, take these questions with you as you come up with your plan, because it makes a really great outline for how to kind of start the conversation. Next, we want to talk about the inclusion of it. So how will our ethics program address the disparities in healthcare access and treatment? Are there any safeguards to ensure that ethical policies do not disproportionately impact marginalized group? We don't want to make a policy that basically impacts what we didn't want to happen, right? And then we want to have integration and continuous improvement. So how are we going to integrate it into our daily decision-making, into our operations, into our clinical care? How will we measure the effectiveness of our ethics program and improve it over time? So when you think about these things and you go to work tomorrow, I really want you to ponder, does my organization have an ethics committee? How are they doing if they do have one? If they don't have one, how can I get it started? I hope that this framework tonight gives you the opportunity to kind of think through that, provide some guidance on things that you can do to get started, and also, work together with individuals in your own organizations to find out what their feelings and their views on ethics are. I use these case studies because they're very popular, so it really makes for great talking points. So, I encourage you to take these to your organization and talk about, is this what you would do if this happened? Would you respond in this way? Or is there a different method or a policy that exists that you could share with me? So with that, I want to thank everyone so much for your time this evening. I am so excited, and I hope that you learned something. I put my contact information, my email address, if anyone wants to reach out or has any additional questions. I am happy to talk to anyone. So thank you so much.
Thank you. Thank you, Emily. Amazing. This is wow. Wow, this is impressive. Señores, impresionante lo que hemos visto, escuchado hoy de la profesora Emily Grime, y ha sido todo un recorrido fascinante que inició presentando casos conflictivos en ética, desde temas del liderazgo ético y la responsabilidad corporativa en centros de salud, en hospitales, ¿qué derecho tiene en un centro de salud de revelar información de los pacientes a terceros? Sabemos que en República Dominicana tenemos normas que regularmente son difíciles de cumplir, ¿no? Y que realmente vemos que en todos los escenarios, no solamente en el escenario de salud, tenemos brechas de confidencialidad, sino que pasa en cualquier institución, ¿no? Donde incluso los seguros de salud en las farmacias, en los laboratorios, piden conocer cuál es el diagnóstico a los médicos acerca de una cuestión que es totalmente privada, ¿no? Ahí tenemos una cuestión. Tenemos el tema de los derechos de los pacientes y el consentimiento informado, que en República Dominicana igual tenemos grandes retos sobre la implementación real y efectiva de lo que es el consentimiento informado. La profesora Emily ha discutido sobre el balance del derecho del paciente a mantener su autonomía, o si las cuestiones de responsabilidad médica toman primacía. Son temas álgidos que se ha presentado acá, incluyendo las cuestiones de aspectos raciales. En República Dominicana tenemos una población migrante importante y también merecen respeto, merecen una atención a veces distinta, personalizada, de cómo regularmente lo hacemos con una persona local, nativo, de habla castellano, español. También comentó sobre los desafíos de la inteligencia artificial y el uso que se está haciendo hoy en día a nivel diagnóstico de la inteligencia artificial Pero la cuestión ética es cómo aseguramos que existan políticas que también son justas para los pacientes en cuanto al acceso a la información, que sigue siendo bastante desigual dependiendo de la capacidad de cada persona. Finalmente, Emily habló sobre la importancia de desarrollar comités de ética, implementar programas de capacitación en ética y en temas específicos en salud, cómo fortalecer el reporte, mecanismos de reporte de situaciones éticas en los centros de salud, sean públicos, sean privados, cómo integrar evaluación de desempeño de cuestiones éticas también en nuestro quehacer profesional en centros de salud. Esto se puede extender a la universidad y demás centros, instituciones, y cómo revisar las políticas de forma regular y hacer los cambios que son requeridos. Así que, Emily, so one of the big questions, and I think you already covered part of it, is how healthcare organizations can effectively integrate all these components of ethical principles into daily operations. It looks straightforward, like inclusion of all the stakeholders to discuss policies, training. It looks like a whole program. Is this really possible for, small organizations, bigger organizations? How do you frame this?
I would say the number one resource would be leadership buy-in. So if your leaders do not agree with what you're doing or aren't, like the phrase is, on the bandwagon, then it's not going to happen. They need to see that there is a positive impact when they do these things. They need to see that it promotes trust in the organization. They need to see that it reduces staff turnover. They need to see that it increases their transparency and their trust in the community. And what happens is that leads to more patients coming in the door. That leads to a good reputation around, so that someone would say, okay, I'm going to work with this doctor because I know that I said no to this kind of procedure, and that doctor worked with me for coming up with another thing I could do. So if you don't have the leadership buy-in, it's not going to go anywhere. That's the truth. So by starting off and talking to your organization about what is, our ethics, what do we have? Do we have a committee or anything? That's a great way to start. Just start the conversation. A lot of times there might be a committee that you don't know about, and I think that that's something that a lot of organizations struggle to communicate that. So, have people that can communicate and do additional trainings and inform staff members, hey, if you're having an ethics issue, there is an ethics committee, these are the people. A lot of times what I've seen is there might be a leader for different departments that is a representative for the ethics committee. And that person might not be included on every ethics evaluation, but when it comes to their specialty, they would be there as a representative to help and assist. So my answer would be just talk with your organization to start, and be sure that you are showing the benefits of what's going to happen to be an ethical organization. Because if you don't have that leadership buy-in, it's not going to go anywhere.
Thank you, Emily. So leadership buy-in, liderazgo, el liderazgo de los centros de salud tiene que, en inglés sería algo así como comprar la idea de la ética, entender que cuando llegamos a un centro de salud y hay todo está sucio, hay escasez de medicamentos, hay escasez de todo, y vemos el trato que se da a las personas en nuestro centro de salud, déficits por todos lados, hay una cuestión ética en el centro de la atención en salud. Tiene que ver con la calidad, con el respeto a las personas, no importando que tenga seguro complementario, seguro básico de salud, hay una cuestión de respeto al paciente, que muchas veces los dominicanos nos damos cuenta que hay carencia, ¿no?, de un buen trato humano y cercano, y sobre todo, obviamente, que responda a la necesidad de los pacientes. Con Emily hemos aprendido, Dr. Ram here, we have learned quite a lot. So thanks, Emily, for all this learning that you have brought to us today.
My pleasure. Thank you for having me.
Así que preguntas, comentarios, Emily ha colocado su email, su correo electrónico. Ustedes pueden perfectamente escribirnos también a Fundación Éticos para escuchar de este tema. Si le gustó, if you really liked it, please fill out the form that we are going to send to you and let us know about how we can improve these webinars, which topics are best for you. Así que déjennos saber sus comentarios. Va a llegarles un formulario para evaluar el conversatorio. En próximos eventos vamos a tener posiblemente traducción simultánea, ¿no?, donde podamos escuchar también perfectamente quienes manejamos menos el inglés, podamos también disfrutarlo al momento. Todo está quedando grabado y vamos a compartir el video con subtítulos, así que vamos a poder disfrutar también de la presentación de Emily. El próximo mes traeremos otro webinario. Estamos retomando los webinarios en la Fundación Éticos con la intención de que la ética sea parte integral de nuestras acciones en el ámbito de salud, en la educación y, ¿por qué no?, en la investigación. Así que les pedimos que nos sigan en nuestras redes sociales, así ustedes pueden tener acceso continuo a todo el contenido que vamos subiendo en Éticos Academy. Muchas gracias y hasta aquí hemos llegado a nuestra presentación de hoy. Thank you, Emily. See you next time.
Yes, thank you so much.
Bye-bye.